Americans are living longer than ever, and if we are prepared for the future, we can lessen the burden on our family and ensure that we are receiving optimal care. The preparation process can be a daunting task and requires careful consideration for all parties involved. If you're not currently going through this, it's almost certain you know someone who is. Throughout this series, you will get the tools to best support your aging family members and their caregivers with compassion and dignity, all while empowering them to make the best choices. Preparing for these future choices can be difficult to discuss between family members and absolutely necessary to make sure that when the time comes, the aging family members are taken care of in the manner in which they feel the most comfortable. Once the decision has been made to start the planning process, there are professionals that may be helpful to seek out for the next step.
Susan, I'm so glad you came over tonight. I know how busy you are with the kids, but Daddy and I thought that it's time we had a conversation about our future.
I'm so glad you're willing to have that conversation. I don't want to have to wonder what your healthcare preferences are during an emergency or if your finances are in order. I really appreciate you being so open. Dad, we have to have this conversation sooner or later. We don't want to wait until it's too late to make decisions.
Fine.
Okay, so Mom, I went on the Neponset Valley Chamber of Commerce website and I looked up agingwithdignity.org and honoringchoicesmass.com, and I put together a short list of questions to help us with the planning process. For example, if you both needed care, where would you want to get it? Would you want to stay here?
Of course. This is our home. We're going to stay here until we can't do it anymore.
Okay, Dad, but if that time comes when you can't take care of the house, where would you want to be? Would you want to live in town or closer to me?
Oh, that would be wonderful living closer to you, Susan, whichever is easier.
Who is your healthcare proxy?
We never thought about that.
Durable power of attorney? Living will? Any kind of document outlining your healthcare preferences?
No, but that's why you're here, to help us.
Why don't I go ahead and make an appointment with your lawyer, Brian, and we can make sure that we get some of those preferences on paper. What about your financial needs?
I don't want to talk about finances.
Okay, Dad, I understand, but we need to figure out if your records are in order and if they're accessible if I should need them. What if I talk to your CPA, Wes, and just make sure you have enough money put aside in case you ever do need services or care?
Okay.
All right, then I'll go ahead and make those appointments as soon as I can. Excellent, thank you. Yes, we're looking forward to meeting you. But just so you know, it may take a bit of finessing to get my dad on board.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. When topics become uncomfortable to discuss, try to maintain respect. You will feel better about the conversation when you look back at it knowing you remained calm and did not get defensive. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Knowing that this conversation is the first of many and taking proactive steps will help ease the stress out of the situation. Don't feel as though you have to take it all on your shoulders. Divide up phone calls and research to other family members. And finally, try to find the humor in the situation. Laughter can boost your mood and help you push through any tough times. Families should connect with the Neponset Valley Chamber if they are looking for a specific professional. You can also contact the Aging Service Access Point to learn more about care options. If your family discussions are a bit contentious or there are serious concerns about how some family members may react, there are professionals who offer mediation services to facilitate these discussions. There is no one-size-fits-all in having discussions about the future with your loved ones. As long as the family member feels empowered throughout the discussion and their choices are documented, future events will prove less hectic. Legal and financial considerations are the backbone to which every future decision is based upon. One of the most important things to remember is to have these discussions while the parent is deemed competent by the lawyer or financial advisor assisting you in this process. Have your family member meet with professionals early, gather the requested data, and file this information in a place that is easily accessible.
Are you sure you want to speak with Brian and Wes right now? I've been perfectly capable of handling our money for the last 50 years.
Now, Derek, it's okay. Nobody is trying to take your money. But Susan needs some guidance, and we're here to document our preferences.
Good morning. Hi, Jane. Hi, Derek. I'm Brian Mahoney, the attorney. Nice to meet you, Susan.
Hi, Susan. Good morning, everybody. I guess we're going to sit down and start the process of doing some long-term planning for Derek and Jane.
Jane and I don't need any help. We're fine as it is. There's too much of a fuss over nothing. We're not going anywhere.
Derek, we discussed this. Susan needs to know where things are. Well, you know how we have things scattered all over the house, especially the cash you have hidden in your toolbox.
Well, let's get on with it and make it quick. You guys are always sending me bills.
Here's a list of some documents and financial information that we'll need from you, and let's go over it and see if you have any questions.
So, first we want to list your assets, everything that you own, the amounts, and how they're owned, especially anything that's owned jointly with the children. This list should include your stocks, your bonds, your bank accounts, annuities, and/or the family home.
Why do you need the bank and investment accounts that my name was added onto?
Well, Susan, even though your name is on the accounts with your parents, they still control those accounts for estate tax purposes and for nursing home costs. So we need to take those accounts into consideration for our long-term planning.
You mentioned nursing home costs. Mom and Dad have a prepaid funeral and burial plan. Is that a good thing?
Those are great to have. Each parent can have $1,500 to put in the bank account for a burial needs account, and both parents can prepay their funeral and burial expenses. And we'll talk about that more coming up as well.
So let's get back to listing more assets that you may have. Now, for the family home, you can use the town's real estate tax assessment to equal the home's fair market value. Now, do you have any pension plans, retirement accounts, or life insurance policies? If so, I want to know the amounts and the beneficiaries on those accounts. So now that we've had a chance to list your assets, we'll take a peek at your liabilities. The home mortgage, a car loan, credit cards, debts that we might consider to pay off prior to somebody entering a nursing home. And lastly, since I do your tax return, I know what your sources of income are. You're both getting Social Security, and Derek has his small pension, his IRA account, and his investment income.
Another thing is you both have wills. That's great. There's a couple of other important legal documents that every adult should have. The first one, Derek, is a healthcare proxy with advanced medical directives and HIPAA release within. What that does is the person you appoint can help you make medical decisions for yourself. And if you can't, they can make medical decisions for you. The other important document that you need is kind of like a healthcare proxy for your assets. It's called a durable power of attorney. That person, your power of attorney, person you appoint, can help you with your assets and income. And then if you become unable due to disability, that person can then take over the assets and income and watch over it for you.
Who would we pick to do all that?
Well, Jane, you'd want to consider the child who's the most competent and responsible to represent you during life and at your death. Don't pick just the oldest child versus the youngest child, or the daughter versus the son. Pick the person that will represent your wishes first and foremost. Once you've made that decision, sit down with that choice, him or her, and discuss your thoughts for medical care, funeral arrangements, and other life-ending decisions.
What if they procrastinate on filling out the documents and something happens to one of them?
Well, it's really important to have the documents prepared and then signed while your parents are able. If something happened and you delay in doing this and someone were to be disabled and unable to sign legal documents, then the family would probably have to go to probate court, which would waste a lot of money.
A trust is an important document that you might want to consider. Now, the trust can be either revocable or irrevocable, depending upon the circumstances that you wish to accomplish, such as avoiding probate at death and/or protecting your house and your assets from nursing home costs. Once you decide upon a trust, you need to think about transferring your assets into the trust during your life, which is known as funding the trust.
What do you mean by revocable or irrevocable?
Revocable means you can change it. You and Jane can change the trust at any time. Irrevocable means that neither one of you or together, you can't change it by yourselves. Can't be changed. What's good about an irrevocable trust is that if you put an asset into it and it's in there for 5 years, then it's non-countable for Medicaid nursing home purposes.
We're worried that we won't have enough money to pay for all the nursing home costs, and we were hoping to save our house for our kids.
Well, Jane, if you and Derek are worried about protecting the home for the children and you expect that there may be a nursing home stay, the family needs to consider the state's financial aid requirements, which must be met before you can apply for benefits. Now, there are many common rules to this, but here's a few. The state has strict asset limitations which must be met in order to qualify for benefits, and an individual and a married couple cannot exceed. An individual can only have $2,000 of assets, and a married couple may be able to keep up to $123,600 of assets for the at-home spouse. If you have assets in excess of these amounts, they may have to be spent down on debts, living expenses, home repairs, medical care, even nursing home costs.
I thought Mom and Dad could gift each of the children $15,000 a year. That isn't the case?
Well, unfortunately, Susan, that's not the case. There's no gifting allowed within 5 years of applying for nursing home benefits. The home now will be considered an exempt asset from these spend-down rules. In most circumstances, the state may place a lien on the home and seek reimbursement for benefits that the state pays you, and then when you die, they may look to the house to have those benefits be reimbursed.
Can one of us stay in our home if one of us has to go into a nursing home?
Yes, absolutely.
Well, what if something happens to Dad? Mom has no other income except for Social Security.
How it works, Susan, is the money, the income, whether it be from Social Security, a pension, or an annuity for the disabled spouse, that typically goes to the nursing facility. However, the government allows a certain amount of income to the stay-at-home spouse, and if she didn't have enough income, some of the disabled spouse's income could go to her.
We don't want to spend all of our money on a nursing home. Is there anything we can do?
Now, as we've talked about, planning for a nursing home stay requires advanced thinking of more than 5 years before entering a nursing home and needing state benefits. The state will not allow you to gift everything away today and qualify for benefits tomorrow. Now, every applicant for state benefits may have to provide up to 5 years of monthly bank and investment account statements with their application. If there are any transfers or gifts to the children within this 5-year look-back period, it will be discovered and subject to a penalty potential calculation. Now remember, every application gets looked at by the state.
My eyes are glazing over. Can we call it a day?
Well, that sounds like maybe it's a good idea. When you all get a chance to sit down with the family and gather your data, Brian and I will start to work up a plan for you.
Great. Thank you so much.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. When topics become uncomfortable to discuss, try to maintain respect. You will feel better about the conversation when you look back at it, knowing you remained calm and did not get defensive. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Know that this conversation is one of many, and taking proactive steps will help to ease the stress of difficult situations. Try divvying up some of the workload. Let organized people handle gathering paperwork while more technology-savvy people look up information and tips online. Play to each other's strengths. Make sure that you take time for yourself and de-stress. You should turn to friends or other family members to talk about what's going on and have a shoulder to lean on if things start to feel overwhelming. Take pride in the wins whenever they come. Every victory is a chance for celebration and helps lift spirits. And finally, try to find humor in the situation. Laughter can boost your mood and help you push through any tough time. Thinking about the future and the decisions that might have to be made is no easy task. However, having the assistance of a lawyer and a financial advisor can alleviate additional stress, knowing that there is a plan in place and documents to support it. We hope this was helpful in providing some guidance into the legal and financial issues when facing the prospect of long-term care for an elderly family member. It's very hard to think of a family member in pain, but slips, trips, and falls are some of the most common accidents for senior adults. Whether you are in your home or out and about, the experience will be traumatic. In this segment, we will discuss the important decisions that you will be faced with and how to better prepare for when the time comes.
Mr. Jones, are you all right?
I'm home alone. I've fallen down the stairs.
Okay, Mr. Jones, just stay there, and we'll send someone over right away.
Hi, this is Susan.
Hi Susan, this is Ashley. I'm the case manager here at the hospital taking care of your father. I'm sorry it has taken me a while to get back to you. I just wanted to make sure that I was prepared to answer all of your questions.
Oh, yes, thank you, Ashley. I appreciate that. I've been really concerned about my dad. Do you know how he's been progressing since the surgery? You know, he says he's doing fine, but a hip fracture is nothing to take lightly.
Yes, he seems to be making progress. His pain is being managed, and he's met with physical therapy once and will meet with occupational therapy later on today. I still need to talk with his doctor, but with a hip fracture, you're usually referred to a skilled nursing facility. Do you know which one your family has agreed upon?
Actually, yes. It was suggested that we look at facilities during the planning process. So if there's a bed available, Dad would like to go to the Main Street facility. Do you have any idea how long he'll still be in the hospital?
Let's see, he was admitted on Monday, so another 3 days.
I read something online about the observation status and how that works with an insurance company. Can you clarify that for me?
Yes, your father is in an inpatient bed and will be here for a total of 4 days, so insurance will cover the stay at the skilled nursing facility. Could you and Mrs. Jones come in to see me tomorrow so that we can make sure that we have all the answers to your questions?
Absolutely. Thank you so much.
Hi ladies, thank you for coming in to meet with me today. I'm happy to report that Mr. Jones is progressing nicely, and the doctor has ordered the stay at the skilled nursing facility, and there is an opening at the Main Street facility, so it's really good that you both did your homework early. So that's really good. As he continues to progress, the case manager there will give you some more information about what to expect when he returns home. Do you have any questions?
What about insurance? What will we have to pay?
His Medicare plan will cover up to the first 20 days, if medically necessary. If the doctor at the Main Street facility suggests that he stay longer, then Medicare will cover a portion of the stay, and your co-payments will be covered by his Blue Cross plan. Theoretically, he'll have up to 100 days of coverage, but that's only if it's medically necessary for him. As long as his rehab goes well, you should expect to have him back home in 2 to 3 weeks.
What happens then?
There will be a case manager like me or a social worker at the rehab, and they will guide you through the process and the timing as to what is next. Most likely, they'll send him home with some home care, which will include visiting nurses and therapists. It will also include his OT and PT so that he'll get stronger and back to his baseline function. If all of that goes well, he should be back to his baseline function and back to normal routine.
Oh, that's great. Will I have to drive him from the hospital to the facility?
No, when he's ready, they will be transported by ambulance.
What should we pack?
You know, he really just needs comfortable clothing for his OT and PT for him to stretch and move. He should have slip-on shoes. Flip-flops and sandals are not recommended. And then whatever he would need for a normal overnight stay, normal personal items.
Oh, thank you so much for your guidance. As you can imagine, this has clearly been very stressful for us.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. If you are confused about insurance coverage, don't be afraid to ask more questions. You'll feel more comfortable being in the know. When discussing continuing care with your family and they seem frustrated, try to remind your loved ones how much you care for them. Taking steps ahead of time will help to ease the stress of the situation. Try divvying up some of the workload. Let other family members run errands, make calls, or attend appointments. Don't forget to take time for yourself and do the things you love to do on your own. Take pride in the wins whenever they come. Every victory is a chance for celebration and helps lift spirits. And finally, try to find the humor in the situation. Laughter can boost your mood and help you push through any tough time. Medicare coverage is based on the number of overnights of acute hospitalization per benefit period. By contacting SHINE, Serving Health Information Needs of Elders, you can be provided assistance to understand your benefits in the hospital and in short-term rehab. They can be accessed by calling 1-800-AGE-INFO. Further information can also be found by visiting the Mass Health and Hospital Association's website located at patientcarelink.org. The mass.gov website provides nursing home survey performance tools. If you are not able to make in-person visits, this is a great tool to utilize. You've endured the traumatic experience of a loved one injuring themselves. They have made it through their hospital stay and are hopefully getting stronger at a rehab facility. Now it's time to think about your loved one returning home and preparations that can be made to ensure they are safe and feel cared for.
Yeah. Good afternoon, Mr. Jones. How you doing? Looks like you're getting some exercise in. So that's good. You must be itching to get home. Oh, got some good news for you. It looks like you're going to be able to go home with some home health services. You're covered.
That sounds wonderful. What types of services do they provide?
They'll provide anything from meal preparation to bathing, showering, med management, all kinds of things. I'll get you in touch with them. You're also going to have a physical therapist that will come 2 or 3 times a week and a nurse that will be there once or twice a week.
I can't wait to get back into my own bed.
Oh, speaking of that, do you live in a ranch or do you have an upstairs?
Stairs? Why is that relevant?
Yes, Mr. Jones, you will not be able to walk up and down the stairs for a while. So you're going to want to put your bed maybe in the living room. Also, you want to get a toilet adapter for the toilet seat. You're going to want to have a shower chair in the shower, and maybe a grab bar in the bathroom to help pull yourself up. That's not going to be covered by insurance. You're also going to want to have a wheelchair and or a walker so that when no one's home, you can move around the house easily because we don't want you to re-injure yourself.
Good point. Dad, I'll make sure to look into all that equipment for you.
So you're going to want to contact the insurance company, find out what's covered, and then we'll get together and have a family meeting.
Great. Thank you so much.
I hate to sound like I'm complaining here, You know I want what's best for him.
It's okay, Mom. You deserve to get out of the house. You should get some time to yourself, too. You know, I think maybe it's time that I start looking into other healthcare options. The insurance money's going to run out soon, and it's good to know what might be available.
How will I know what agency is right for us? It seems so overwhelming.
Don't get overwhelmed. I'll figure out how to start looking for agencies.
I'll ask the lady at the senior center. I remember her saying that there are lists available for seniors.
That's a great idea.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. If you are confused about insurance coverage, don't be afraid to ask more questions. You'll feel more comfortable being in the know. When discussing continuing care with your family and they seem frustrated, try to remind your loved ones how much you care for them. Try divvying up some of the workload. Let other family members run errands, make calls, or attend appointments. Don't forget to take time for yourself and do the things you love to do on your own. Support groups can be a great resource for caregivers. Don't be afraid to turn to others that are in your situation, as they can boost morale and empathize. And finally, try to find humor in the situation. Laughter can boost your mood and help you push through any tough times. Always make sure to speak with a few different agencies before making a decision. Ask if they are bonded, insured, and licensed. Ask if they perform background checks on their employees and if they drug test. What type of training and education do they require from the employees? Get a list of what they will and will not do in order to determine if they are the right fit. Ask how the agency supervises their caregivers and what type of quality control they conduct. How do they like to communicate between the family, the agency, and the person being cared for? Find out what the costs are or if they work with insurance. You may be pleasantly surprised to find that some of the cost is covered. The more questions you ask prior to employing a caregiver, the better the experience will be for all who are affected. Check out the NVCC website for agencies listed under our membership. Another great resource is 1-800-AGE-INFO. The best type of referral is word of mouth. The Council on Aging is a great place to meet other seniors who have used these services. Moving your loved one from the house they've lived in for years to an assisted living community can be filled with joy and excitement to start a new chapter in a place where they can worry less about maintaining a house and do more living. It can also be a time of stress and worry for the entire family. This segment will show you the different ways to make the act of moving a positive experience.
Well, hello, Susan and Jane. It's so nice to finally meet you. What can we do for you today?
Well, Jack, my father fell and broke his hip about a year ago, and they've been back in their place for the last 9 months with a home health service, and Dad's doing pretty well, but he just isn't up to the physical care and maintenance of the house anymore.
Well, that's true, and I really don't want to drive us around anymore. You know, my eyes aren't what they used to be, and I'm sick of your father complaining about my driving. It's just that I don't want to feel like we're moving into the old age home.
Well, you know, I hear this kind of a thing all the time, and quite frankly, what you're thinking about as an old age home is something that might have existed 20 or 30 years ago. But today things are a lot different, okay? Our community, for example, has so much more to offer, okay? It's a very action-oriented community. It's an independent community. We've got drivers. You mentioned driving. We can accommodate that. We've got cars and drivers during the week that will shuttle you around town. We've got walking trails. People have pets. We've got a number of people that have dogs and cats and so forth. And we've got a raised gardens. We've got a wonderful auditorium. We have chorus groups. We have lecturers come in from outside. We've got professional athletes that come in and speak. We've got a wonderful library. There really is so much to offer today, and there's so much diversity in the community in terms of activities and people you'll meet that, quite frankly, you're not moving out of anything, you're really moving into something. There's quite a bit here to offer you.
Well, that sounds wonderful, Mom, and it's close enough to me that we can come visit you anytime you want.
I like the sound of that. Could we go and look at a place? I just want to make sure our living space is homey.
So why don't we do that? Why don't we take a walk around the community? I'll show you the common areas and a number of our apartments, okay?
First of all, I want to thank you for having me to your beautiful home. I know some of the logistics of selling the family home can be overwhelming, but I want you to know I'm here every step of the way, and I will never force you to make any decisions you're not comfortable with.
That sounds nice. The thing that I'm most overwhelmed by is what to take to the new apartment and what to leave behind.
Well, we have a network of professionals, and I can assure you I will get in contact with the best senior move manager and have her or him call you.
I'm not looking forward to having strangers in my house, and I don't want the neighbors knocking on the door and peering in either.
Well, that's a very common request, Mr. Jones. We don't advertise the house with the sign out front, and we don't put a locked up box on the door because we don't want people knocking on the door and bothering you. The only person showing the house will be me.
Well, obviously we want to sell it for top dollar. Mom and Dad are going to need that money for the new apartment. But what if there are changes or renovations that need to be made?
Well, we have a network that includes elder law attorneys, senior move managers, contractors, health, home care assistants. You name it, we have a nice working relationship with them, and it's really a team approach.
This has been here longer than you, Susan. Why would I just throw it out? It's priceless.
We're not going to throw it out. We're donating it. Okay, if it means that much to you, I'll take it home and put it on my coffee table, and then I'll throw it away.
Fine, you are the boss.
Hi, ladies. How's everything going over here? Can I help you decide what box to put this in, Jane?
Sure.
And what about that cup and saucer? Is that something you think you want to take with you?
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. When topics become uncomfortable to discuss, try to maintain respect. You will feel better about the conversation when you look back at it, knowing you remained calm and did not get defensive. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Try divvying up some of the workload. Let organized people handle gathering paperwork, while more technology-savvy people look up information and tips online. Play to each other's strengths. Make sure that you take time for yourself and breathe. Tell friends or other family members what's going on and have a shoulder to lean on if things start to feel overwhelming. Take pride in the wins whenever they come. Every victory is a chance for celebration and helps lift spirits. Be sensitive to your parent or spouse's dilemma. Allow them the chance to breathe and make mistakes, especially when topics like depression, anxiety, or confusion come into play. Remember, not every person is in touch with their emotions. And finally, try to find the humor in the situation. Laughter can boost your mood and help you push through the tough times. Once your family has found the right care facility that they feel meets their needs and makes them feel comfortable, utilize the expertise of their staff to guide you on contacting a senior real estate specialist or senior move manager. When interviewing these companies, ask for their experience, credentials, and fees. Carefully review contracts and beware of limitations and care plans. Ask for references and find a team that works exclusively with the senior population. It really does make a difference. Trying to make the transition alone can sometimes cause more strain on a family than necessary. When a loved one shows signs of forgetfulness, if they aren't making sense like they used to, or they are neglecting their own care, it can be hard for that person or the family to accept that they are suffering from a memory impairment illness. Usually, the person suffering is the last to know, and it can be hard on other family members to understand what's happening and properly react. The illness directly affects one person and indirectly affects many people. In this segment, you'll be provided with resources to care with compassion, patience, and most importantly, the knowledge to navigate the logistics during this stressful time.
You know, Susan, I hate to talk about your mother like this, but lately she's been doing some really crazy things.
Like what?
It's not funny. The other day she left the stove on and went to the hairdresser. On top of that, she loses her keys everywhere she goes. She doesn't take her heart medicine. On top of that, I had to tell her that she hadn't showered for a few days, and she was upset by that, but she changed the subject. I'm really getting worried. She may walk off sometimes. She'll disappear. And what happens if she takes too much medication?
Dad, I had no idea it had gotten this bad. You know, the other day I was talking to her on the phone, and she called me Mary. I figured, my voice sounds like hers, and she just got us confused. I'm really glad you brought this up.
Well, a month ago I wouldn't have listened to it. I wouldn't have believed it. But now I'm getting really concerned. I think we should bring a doctor into it.
Okay, I'll call a neurologist. But you've got to tell her with me, because I don't want her to think that I'm calling her crazy.
Yeah.
Hi, Mrs. Jones. I'm Dr. Nasser. Do you know why you're here today?
No, I don't know. My daughter brought me.
Yeah, so I'm what's called a neuropsychologist, and I believe that you've seen some of my colleagues in neurology and had some other tests done. Today, I'm going to give you some paper and pencil type tests that look at your memory, your attention, your concentration. It will feel a little bit like school, okay?
You were always a good student.
Why don't we get started? First, I'm going to say some numbers, and I want you to say them back to me.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Be sensitive to your parent or spouse's dilemma. Allow them the chance to breathe and make mistakes, especially when topics like depression, anxiety, or confusion come into play. Remember that not every person is in touch with their emotions. Take pride in the wins whenever they come. Every victory is a chance for celebration and helps lift spirits. Learn what you can do about illnesses and problems so that you can deal with them as best you can. Find new ways to communicate with your partner. Don't just correct them. Live in the moment and remember that your loved one was once able to communicate with you. There may come a point where family members might not be recognized. Try appealing to your elders' emotional memory, or use music or foods that they have a connection with to help them remember emotions. Go through old pictures, help loved ones label old pictures with the names to reminisce. And finally, try to find the humor in the situation. Laughter can boost your mood and help you push through any tough times. Once you've accepted that memory impairment may actually be an issue, address it with compassion. After being diagnosed, other family members should explore different care options available to them, including home care and community care. Ask questions about the level of care a service will provide. Will activities of daily living be addressed? Is care time measured or charged by the minute, hour, or unlimited? What are the limitations of a service or community? What are the emergency procedures of a service or location? What options will provide your loved one with the best quality of life for the longest amount of time? Many memory-impaired people cannot express what their needs or wishes are anymore, so it's always good to plan ahead and have these things documented to eliminate miscommunication and ensure the loved one is still heard. Don't forget that your loved one is still a person, even if they are not acting as they once were. They can still interact with the world and the people around them, just in a different way. Treat your loved one with dignity, respect, and a thoughtful approach, and more often than not, you will have successful interactions. When given a diagnosis that is life-limiting, whether it is 2 years or 2 months, the news can be overwhelming for the entire family. Luckily, there are many ways to help make the entire family feel comfortable and supported through this difficult time. Choosing which option is right for your family requires a bit of research, and in this segment, we'll explain the different resources to help make your search easier through this stressful time.
How are you feeling, Dad? Are you in any kind of pain? Do you need more medication?
No, I'm okay, Susan. And I want to thank Jack for getting the hospice person even before Dr. Moore ordered it. That was a big help. How are you doing?
Dad, why are you even concerned about me? With all you've been through with the chemo and the surgeries and the hospital stays, doctor's visits, I'm just glad that you can be in your own place with your own stuff and really kind people to help take care of you. I'm sure a lot of the other options would have been fine too, but it's nice to know you're in your own home.
No, I'm very thankful that I am here, that I can be with your mother, even though we can't communicate any longer. I don't know what I would have done if I wasn't beside her.
Well, we will take care of her, and we will work with the hospice team too.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. When topics become uncomfortable to discuss, try to maintain respect. You will feel better about the conversation when you look back at it, knowing you remained calm and did not get defensive. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Be sensitive to your parent or spouse's dilemma. Allow them the chance to breathe and make mistakes, especially when topics like depression, anxiety, or confusion come into play. Remember that not every person is in touch with their emotions. Make sure that you take time for yourself and breathe. You should turn to friends or other family members to talk about what's going on and have a shoulder to lean on if things start to feel overwhelming. Live in the moment and embrace life for how it is. Some things are just out of our control, so accepting that can help make sense of the unknown. Accept the help that hospice can provide. It allows caregivers to become family members once again and allows for a better connection between themselves and their elderly family member. Don't let your biggest regret be that you didn't have hospice services sooner. Hospice care is delivered by an integrated care team of specially trained physicians, nurses, certified nursing assistants, social workers, chaplains, and volunteers who all work together to meet the individual needs of each patient and family. Hospice also includes grief support by trained licensed social workers. The best place to start is both the National Hospice and Palliative Care Organization and the American Hospice Foundation. You'll find suggested questions to evaluate quality of care and help you make an informed assessment when choosing a hospice. Costs for all patient care, supplies, and medications related to the life-limiting hospice diagnosis are covered by hospice. There is generally no cost to the patient. This coverage includes some medications and medical equipment like wheelchairs, hospital beds, and walkers. If you are over 65, your hospice services are paid in full 100% by Medicare, the federal insurance program. Other insurance programs also have hospice benefits that mirror the Medicare benefit. Most patients will not be turned away due to the lack of insurance or inability to pay. Check out the NVCC website to see our members who provide these services.